So yeah, I'm going to hand over to Peter with a little bit of a presentation coming up. Again, regenerative medicine, anti-aging, longevity, and how we can get there safely, naturally, and how we can get that information out there. So thanks for joining us.
All right, thanks, Brian. Thanks everybody for joining. I'm sorry this is going to be a little bit obstructive. I'm not going to stand in front of the TV the whole time, so you'll be able to see the slides. It'll focus a little bit more, but mostly it's about what we're trying to actually talk about and the idea or how to actually think about our health and longevity, but also how we can make our bodies work again. Um, the way we've constantly been told, or actually the information has been disseminated throughout society, is really that you just get older and this is the fact of life. Well, we do, but I can show you two very different people, two people who have lived 70 years, and one can go on a hike in the Alps and take vacations and go for a jog, and the other one has a hard time getting out of a chair, right? They both lived 70 years. There's a big difference here and how we've actually aged. And now, through a lot of technology, through research that's really only been going on for not even 10 years, almost 10 years in the longevity space, we know a lot more information about why these things happen and what we can do about it. And so we're going to jump right in. And if you have any questions, feel free to pop them into the chat and we'll address those kind of at the end. Those of you here, if you have any questions, we can address them right away if you want. But either way, we can ask plenty of questions at the end. This will take maybe about 20 minutes or so. And I tend to go on and on about some of this stuff because I love it. And it's really a lot of fun. So we are Biolyfe. This is a rebrand this year from what we were doing previously, but I've been going down the road of epigenetics and regenerative medicine and anti-aging for the past few years. And Alicia came on board and is doing all of the procedures and infusions and injections. And she's highly trained in that. And she's an absolute expert at doing that. Nobody can get the stuff done that she can get done. So it's really wonderful. And she also really loves this stuff. This is actually one of the best things because finding people who actually are really into anti-aging, longevity, just health of how the body works. A lot of people just want to do their stuff and then go home, but Alicia is really involved in this and it's really wonderful. So as an overview, that's kind of a little bit who we are. We're going to go over a couple of things, what I like to call Aging 101, but mostly it's about health and regeneration. Like I was saying before, over the past 10 years, there's been so much research, and this area has been booming so much, meaning before 2017, really, there wasn't much information or even thought about can we extend a healthy lifespan throughout our life? We just thought, well, it was up to genetics. You know, some people did better than others. Okay, if you had a really bad lifestyle and you smoked or so, then maybe you would have a harder time. But along came things called epigenetics, and this is gene expression. And we had epigenetic clocks and things like that. I'm going to talk about some of those a little bit later, but we'll get into aging and regenerative medicine, why movement is pretty much the most important thing that we can do. And then some of the things that we are doing and why we're doing them and how they actually work for you. Some of you may have been reading a lot about stuff, podcasts, books. There are people talking about this ad nauseum these days. And if you want to try to put it all together yourself, it's going to be kind of hard. Has anybody heard of the Rejuvenation Olympics? Anybody? No. There's a website you can go on. You can upload all your health data and stuff like that. And there's a whole leaderboard. There are people that are putting their stuff on there, and people are trying to get up to it's kind of insane. It's a little nuts, but it's really interesting because they are basically self-experimenting on themselves, which isn't necessarily bad, but we don't want to do this in an uncontrolled fashion. So that's what we're here for. My background, basically, so I was trained as a chiropractor. I had a background in biology, and I have two undergraduate degrees in biology and human biology. Then I was trained as a chiropractor and was really into non-surgical orthopedics and movement and sports and how the physical body moved. From there, I did a sports physician license, and then as regenerative medicine really started to take hold, so when you're in school and you're in undergraduate programs, graduate programs, nobody talks about regenerative medicine, or you don't learn this stuff. You hear something about it, they say something about it, and then if you want to learn about it, that's all afterwards. You have to really go down that path and figure out how that stuff works. Um, I also got certified in hyperbaric oxygen therapy for anti-aging, which is a tremendous thing that we will eventually be having in our clinic as well. We just don't have it yet. Um, I trained in this under Dr. Matt Burnett, who was a co-founder of Fountain Life Clinics with Tony Robbins. And this is where they kind of really started using the regenerative products that we're using in our clinic now. And they started developing these protocols of how to actually take somebody and rejuvenate various parts of them and also measure all this. So there's part of what I do that's based on a lot of these protocols that they've done. That screen looks a little blurry. I'm gonna step out of the screen so you guys can see the pictures a little bit more. It does there, that's a little bit better. Okay. Basically, that's a little history on me and why I'm doing what I'm doing. I want to talk about just the way of thinking. So the way of thinking is that you either have, like I said before, you get older, things start to fall apart, or we can always regenerate our body. So this is really important to think about. So for instance, Tom, how old's your liver?
My liver?
Yeah,
Well, if it's the same as my body, it's 56. But
that's what we would think, right? Every organ in our body would think, okay, is it 56? It's actually really only 3 years old. We're constantly regenerating, right? So cells last a certain amount of time and then they give off a whole bunch of new cells and then they die. And then we have all new cells. So every organ has a different rejuvenation time span. So skin cells last a week or so and then they die. So it's a little bit quicker to regenerate, but and then other organs might last years, right? So we're constantly rebuilding our body. Even take somebody who had heart disease and severe heart disease, heart attack, triple bypass surgery, congestive heart failure, change everything from their lifestyle, add different medications, different treatments, and everything. And in 3 to 5 years, it's possible, and I've seen this in the clinic I worked in Germany, where you have in 3 to 5 years somebody who has no detectable heart disease at all, because they've been able to rejuvenate their actual heart tissue, right? This is something that up until recently, and this is only being done in the lab right now, as far as heart tissue is concerned, people thought you can't regenerate heart tissue. Well, it happens naturally if certain factors are there. So the problems that actually happen are that we have a lot of hang up in getting certain technologies and products and scientific revolutions from research to actual use in a clinic or to market. And the average really is about 17 years. That's a long time to get something from, hey, this is a safe, effective product or treatment or procedure. And 17 years later, we get to start using it on people. A good example, one of the best examples was again with the heart. They did a stem cell injection directly into a heart muscle. And this is over 20 years ago. And the ejection fraction of that heart doubled. And this was somebody with heart failure that was going to literally die because of their heart failure. And they ended up restoring a normal lifespan expectation with that. This is over 20 years later. It's not an approved procedure. It's being done in some other countries, and here it's been done as compassionate use for some people, but it's not an approved procedure. It literally cuts heart failure patients' death rates by 58%. If we could do that, why aren't we doing that? Well, regulation and everything else, but that's what we're here for, is to kind of push that to clinics like mine and other scientists and other facilities around the country and around the world, trying to push that envelope, push that boundary a little bit, so that we can get things that are known to be safe and effective to people a little bit quicker. That's a big point here. We're going to move on to some really interesting science. Hopefully on the Zoom call, people can see that screen. The hallmarks of aging. The reason I'll talk about biological age in a minute and why we should care. But the hallmarks of aging, there are at this point probably a couple more than these. There are probably about 15 in the research right now. Started with 9, these are 12. These might be a bunch of words that people have heard of or not. It might be all a bunch of sciencey jargon that doesn't make any sense. But either way, these are all things that we know change as you age. And this is stuff that we can measure. And that's what's important here, is that stuff that we can measure that we know changes people age. Not every one of these things can you do something directly for. Like, for instance, telomere attrition. If you've heard of telomeres, those are things that actually shorten. And as they shorten throughout your life, they're the end of chromosomes, and then they correct mutations and that kind of stuff. But as they shorten, your incidence of cancer goes up, for instance. We can't give something right now that says, this is going to lengthen your telomeres, but we can do different things in our lifestyle or supplements or some of these other treatments that over the course of some time, when we measure and measure, they will get back to better lengths and healthier lengths. So not everything we can do something directly for, but through the various programs that we've set up, you can address pretty much every one of these things, and we can measure all of these. If you want to look up hallmarks of aging, there's tons and tons of papers at this point about it. And it's very interesting stuff, because these are, again, the reasons why we start to fall apart, basically. Why things stop, eventually things stop working a little bit. In our 20s, we think that we're immortal and everything works really well, right? And sometime in our 30s, sometimes 40s, people start to go, well, this doesn't work as well as it used to. I thought it would work forever. So either way, these are the reasons. These are the things that go wrong. And if we can identify those things, then we can actually do something about it. And the earlier we actually take action on that, the better we're going to actually be able to do something about it, or the easier we'll be able to do something about it. We're going to get to epigenetic changes in a little bit, but epigenetics is basically the expression of our genes. And I want to describe this a little bit to everybody. So every cell in your body, a skin cell is a skin cell, a brain cell is a brain cell, a liver cell is a liver cell, but each one of these cells has your whole genome in there, right? So it's not like you just have skin genes in your skin cell. You have all of your genes in your skin cell, but only the skin genes are turned on, right? So all the other ones, the bone, the muscle, the liver, the brain, the heart cell genes are turned off. They're silenced. But when you have a cell that starts to dysfunction through a lot of these pathways, you get misexpression of genes. Genes turn on in cells. And in our skin, we might go, well, I've got a rash in my skin. That's because we've got not just skin genes turned on, we've got a bunch of other genes turned on as well. And now this is a kind of a skin cell, kind of works that way, but it's not really a healthy one. That one keeps replicating and the rash stays there, and it kind of spreads. When we can turn that stuff back off, turn off those genes that are faultily expressed, then your skin cell literally turns back into a skin cell, a healthy one. And this is how we're talking about cancer, neurodegenerative diseases, heart disease, diabetes, or other metabolic diseases. All of these diseases are all because, well, not all because, but a major factor that we're finding is that it's epigenetic changes, that if you can reverse those, you can make huge impacts in how well your body actually functions. So biological age. Biological age, again, is the difference between our chronological age, how old we are, and how old our body is. And like I explained before, it's different in different people. So why do we really care about that? It's literally because this is how well our body repairs and rejuvenates. When I talked about the organ rejuvenation, this is happening all the time in every system in our body. And if we can't keep up with enough repair because of too much damage, then it's going to start to fall apart. It's literally how it goes. So if we can, the overall goal is to minimize damage. And we do that through a lot of lifestyle things, right? So I could increase damage. I could smoke and drink too much and eat a bunch of fried food and not exercise. And that's going to be a lot of damage. But if I do a bunch of healthy things, and then if my body can maintain the energy for repair, all of the cellular energy for repair, then I can maximize how well my body keeps up with rejuvenation of every single one of my organ systems. When we measure biological age, that's what we're looking at. Every one of your organ systems, from the brain to the heart to the liver to the kidneys to the immune system to all these different systems, we combine the function of all those, and that gives us then a biological age. If we say somebody is 77 years old chronologically and we measure biological age and it says 87, that's not good. That means you're aging faster than you are chronologically. If it says you're 60 years old, now we're talking about we're doing better, right? We're actually improving or improving how our body rejuvenates and how it works. When we do certain things, you can literally reverse your biological age. And so that's why we really care about biological age and why the measures are there, what we're actually measuring. When you think about health, uh, the way that we've been kind of taught to think about health is that you're not in a disease state. You don't have diabetes. You don't have congestive heart failure. So that means you're healthy, right? Well, not really. I mean, health really means high level function, energy, physical ability to do things, getting up in the morning and going, I'm not stiff and I feel like attacking the day and doing things because I've got the energy and the motivation and the drive to do it, right? So that's what health really is. Not, well, I'm not diagnosed with diabetes yet. That's not really health, but that's what mostly is being treated. So nobody or nothing, no hospital system actually is even allowed to really treat something until they have a diagnosis. We can diagnose this disease now because your A1C got to 6.5. Here's your drug for it, or here's your treatment for it. Well, that's a bit late. That's kind of like saying, and we see that you have cancer. It's small. We're going to wait 5 years. And when it's all over your body, we'll try to treat it. That sounds kind of silly, right? If we see things going in the wrong direction, we can change that. And if we look earlier and pay attention to how our body's working, that's when we want to actually do something about it. I don't really, everybody who knows me knows that I don't accept sayings like, well, I'm older, so that's what that's what happens. Because even though that's going to happen somewhat, we don't have to accept all of it. So that's biological age in a nutshell. How we started to measure that, how the scientific community got there. Dr. Horvath, I think it was 2013, invented the Horvath clock, or the biological age clock. And they were measuring epigenetics. So that's gene expression on your DNA. And they were measuring a handful of sites there. Now we're measuring hundreds of thousands of sites actually on your DNA. And that's how we kind of analyze your biological age and get the system organization. It improves every year because algorithms are trained more and more and more every year. I'm going to skip over DNA methylation because that's how epigenetics works, but that gets really a little more complicated. But it's basically chemical caps on top of DNA that change expression of genes. They either turn genes on or turn off, and that's how we measure it, is the amount of methylation on these genes. Besides that, we measure a bunch of aging biomarkers. So when we go back to that slide about the hallmarks of aging, then we see cellular senescence. We actually measure the senescence load in your body and how much that's actually affecting you. So cellular senescence, those are zombie cells, cells that stop dividing, stop behaving normally, but they don't die. They're supposed to die, or our immune system is supposed to clear it out, but it doesn't. And those release inflammatory molecules that turn other cells into cellular senescence. And so we're measuring all these other things as well in our aging biomarker panels. So we measure biological age and then aging biomarkers. I'm going to talk a little about regenerative medicine now, because this is where the most power is in treatment options. It started with, I want to dispel a couple of faulty ideas. First of all, stem cells. When stem cell treatment started, when people started thinking about, hey, here's stem cells. Oh, stem cells can grow new tissue and rebuild everything. And there was a lot of controversy around stem cells. They were taking embryonic stem cells. These are literally stem cells from, well, they're the original cell, and they were taking them from fetuses, so on and so forth. But either way, the point is that those were stem cells that were pluripotent embryonic stem cells that can turn into everything and anything, including a bunch of tumors that have shown up in people when they had those types of treatments. That is more than 20 years ago. Those types of things still surface today, but that's old information. So the stem cell treatments today, if you're hearing about stem cells, these are the mesenchymal type stem cells. Those are further differentiated. They do not produce tumors. They do have the capability of actually rejuvenating and regenerating tissues. Those are actually cells. Now, when we talk about cells, those have DNA in them. They have antigens in them. So your body either recognizes them as self or foreign. When you take cells from Wharton's jelly, that means that's from placental tissue or the umbilical cord. You take the cells from there from a live birth, and then you might infuse or inject them into a person. The person might reject those cells or they might not. It really just depends on how long it takes for the body to recognize those as foreign, right? So the cells do work, but they also may not work. They go into the body and your body may kill them directly, or they last for a little bit of time and do their work and they work. So that's where we got to at a certain point. And then the magic of exosomes came in. Exosomes are literally the way stem cells work. So when you have stem cells, you put a stem cell into something, they thought that cell turned into your tissue. You put a stem cell into your knee, they thought, well, that's going to turn into your knee tissue. Turns out that that cell doesn't do anything like that. All it does is secrete a little molecule, a messenger molecule, that goes and binds to your own cells. And those cells then turn into your new tissue. So it works, but now all we have to do is take those little messengers, those exosomes, and we concentrate those to a really high level and put those in your body in different areas, whether we put them into a knee, a hip, a shoulder, or infuse them directly in an IV for them to go systemic. They have all of the coding, all the properties to build every piece of your body. I'm going to talk about where those things come from in a minute. But the main point here is to learn is that stem cell activity, the way stem cells work, is by secreting exosomes. And when the cells have to stay alive in your body for long enough to secrete exosomes, we skip that step, take the exosomes and put those in. Now, you can get exosomes from a couple different places, a lot of different places. Pretty much every cell in your body secretes exosomes. We want exosomes that have all of the signaling molecules that you really need. So where we get them, you can use stem cell exosomes, which are from Wharton's jelly, but the way we do it is from purified amniotic fluid. And this is the real magic behind it, really. Amniotic fluid surrounds a baby and it grows that baby. It takes a single cell, an embryonic stem cell, pluripotent stem cell, and divides that, and then it programs it into every cell in the body. It says, we're going to build a liver now. Here's the program for that. We're going to build a right knee. We're going to build a left knee. We're going to build a brain. It has the programming that programs these cells, the epigenetic programming, back to gene expression. And so amniotic fluid has every one of these growth factors, all of the things that your body, to build every piece of your body. And that's why they can be so powerful. There are no DNA or antigens there for rejection of your body. Your body does not reject it as foreign. It recognizes it as something that, hey, we all grew in this. It's beautiful. There's no adverse reactions from these types of treatments. It restores the growth factors that decrease as we age. And those things are what I'm talking about are some of these hallmarks of aging, but we can see in research they've shown these certain growth factors, these certain molecules, these certain levels in your body decrease in everybody as you age. And sometimes at one point, they're completely gone, some of them. If you restore these things, if you get them back to good levels, and this is back to me talking about function and optimizing function, not waiting till you're at a disease state to do something about it, to say, look, we want to get to this level to maximize how well your body actually works. When we restore those things, then your body is able to reproduce and regenerate every organ system constantly. That's the beauty of that. We're going to move on a little bit from that topic. It won't be too much longer, but I want to talk about how important movement is in health. It's half as important in our whole body health. Everything else that we can do equals 50%. Exercise and movement is the full other 50%. If we can't exercise and move, things fall apart quickly. I don't care how well you eat. I don't care if you're the best meditator in the world or whatever else you're going to do. If you can't move and exercise, things go downhill. So if people have pain, if you have an injury, if people have a bad ankle, a bad hip, whatever it is, and they say, I'm not going to go to the grocery store today. I'm going to order my groceries. I can't go on that walk. You start to slow down. You don't move as much. You don't do these things. And that decreases literally how well your body can regenerate. It is that important, and mostly because of blood flow. also a number of other reasons. You break up cross-linked proteins, you increase cell regeneration, you actually activate stem cells, and you boost recovery, all these things. But blood flow is really the most important thing. You stimulate lymphatic drainage, which is actually just getting all the gunk out of all the areas in the body. It's important. And these are just some of the main things that blood flow does. But the main reason that we have anything that goes downhill is because of lack of blood flow, enough blood flow to the area. So I'm talking about your brain, your feet, your your hands, and anything else, right? So we are looking at a bunch of different ways to improve blood flow. One of the main things that exosomes will do is increase something called VEGF. There's a ton of VEGF. That's a vascular endothelial growth factor. We lose the ability to grow new blood vessels to various areas of the body, particularly farther away, hands and feet. We can do it internally a little bit better, but our brain, our hands and our feet in different areas have a harder time, and things start to literally fall apart. Stem cells are how we heal. Our natural stem cells are how we heal. Blood vessels, new little capillaries carry those stem cells. If we can't get new blood vessels to these areas, you can't regenerate and heal. You just can't do it. When a 3-year-old cuts their skin and a Band-Aid falls off 3 days later in a bathtub, it's all better. When we bump our elbow, we got a bruise for 3 weeks. We're like, what happened, right? How come we can't heal as well? We can't get as much blood there as we used to. Can we regenerate and rejuvenate that? Exercise, movement, you have to do that in order to get that to happen. So lymphatic drainage, angiogenesis, that's new blood flow. Your brain, neuroplasticity, that's the ability for your brain to actually learn and do different things. Delays the loss of brain volume as we age, which creates dementia. One of the reasons you create dementia, but it's really argued that the main reason for any type of dementia is blood flow restriction to various areas. It's just not enough. It doesn't mean you're having a stroke or had a stroke. It means decreased blood flow. And now that's something that we're actually learning to measure. We're going through some training on that. It also has a reduced risk of cancer and any other type of disease process that we're talking about. That's how important blood flow is. Yeah. Yeah.
I don't know what lymphatic drainage is.
Oh, lymphatic drainage. So basically everything that, if you exercise and you're sore, the reason is because of a buildup of all the byproduct of the chemical reactions from exercise. And that stuff has to drain out of the muscles. And it happens all the time, but it only happens with muscles squeezing the veins or squeezing the lymph vessels. That's the only way it happens, or gravity. But we're not hanging upside down very often, or for very long. So it's really through muscles squeezing it, and that's movement. So it's our immune system. Everything travels through these lymph vessels in our body. So it's how we drain out the gunk, process it, recycle it, and then get rid of the waste. That lymphatic system is everywhere, and it's all important for that. Does that make sense? Yes.
You can get massage for that, right?
Massage for that.
Mhm.
You can manually get it out.
Mhm.
There are a lot of different modalities or different treatments to help get it out. But yeah, the way you get it out is by moving. Otherwise, it literally sits in there. So that's it. Yeah.
Great. Thank you.
There's just a slide on importance of muscle. I think everybody understands that, at least to some extent, from what I just talked about now. So all of that to say, how did we get here? How do you get to this point? How do we get to maximum regeneration? How do we maximize our ability to regenerate our body? So basically, everybody should take care of the basics. Everybody can take care of the basics. Exercise and movement, right? Nutrition, eat whole natural foods. Sleep, good sleep hygiene, good sleep practices in setting the circadian rhythm. Stress resolution, have to do that. If everybody takes care of the basics, things obviously still are going to go downhill. If they didn't go downhill, we'd have a whole bunch of starving vegan monks that are 180 years old. But we don't. I don't know how old they are, actually. Maybe nobody knows. But either way, things still start to fall apart. But that's where some of these new technologies, these treatments come in, and where they actually can start to rejuvenate tissues, and where we can measure that stuff. So these things that fail, these are the main categories of things. We have orthopedic injuries. knees, hips, primarily in people. And when those things start to fail, when we have a fractured hip, when we have an arthritic hip or an arthritic knee, and people say, well, I can't do this stuff anymore, their life expectancy plummets, their health span plummets. It's really, the statistics are really disturbing. I won't even talk about them because they're pretty bad. But then everything that I've talked about, from blood flow, but also a bunch of other metabolic issues, lead to these metabolic diseases, like diabetes, for instance, most common one. It's huge in the United States. We have a big problem with it. It's actually preventable, but people, again, aren't doing anything about it until they get diagnosed with it. Now you're diabetic. Let's do something about it. Well, that's a bit late. Cardiovascular disease, cancer, neurodegenerative diseases. These are the main things, that the main chronic problems that people get diagnosed with and suffer from for years. And that's what we're trying to avoid. The picture is this: if we were all able to say, all right, everybody lives to 100 years old, right? And everybody's like, all right, that's cool. I'll live to 100. That's all right, I guess. I don't know. And then I say, well, you get to live to 100, but the last 30 years are going to stink. You get to live to 100 and you'll be on a hike at 99. So what would you rather do, right? So that's kind of the overall picture. We want to maintain and maximize health and the ability to do high function while we're getting old. Um, we have different programs. The programs that we have, basically, you can do individual things. If you've got a bum knee or a bum something that's not working very well, we've got to regenerate it or make it work again. Um, Cutting it creates a lot of scar tissue. And if you have to, sometimes it happens that we need a surgery for some things, but most things these days, you can actually regenerate. Systemic rejuvenation. So this is where we get into the testing of biological age and aging biomarkers, and then do IV infusions to actually change that. Also, with a whole bunch of guidance on, these are the things we found that you need to address, rather than shotgunning and saying, well, I think a multivitamin is good for me. Should I take vitamin C? Do I need this? Who knows? Nobody knows. We have no idea, unless we're actually measuring this stuff on a really deep level. So these things actually reduce biological age when we do these programs, and I've seen it in and my training in Pittsburgh and with Fountain Life. They've been reducing people's biological age by up to 13 years by doing these yearly programs, and that's significant. Not only that, you feel great, feel really good in doing it. Those are the base programs that we have. Of course, there are the highest level, everything that we could possibly do. But the base package, what we do is this includes the testing 2 times a year, where we really get a good layout of where you are. And then we have a bunch of programs around those things. Some people might need some gastrointestinal help. Well, everybody needs gastrointestinal help. Some people might need very specific vitamins or nutrients or supplements to rejuvenate parts of their body. Some people might need higher levels of exosomes, and some people might need lower levels. And so that's basically where we are with the different types of base packages, and then the maximum type of package that just gets everything that we do, and we put everything, and we do the maximum amount that has so far been researched to show we actually reduce all that biological age and aging biomarkers. We think that this is one of the most comprehensive and cost-effective memberships in the industry. These things are not cheap. I understand that, but this is another main point to think about. One of the reasons that things have a hard time getting to market or getting somewhere is literally because of cost. When things cost a lot of money, it's hard for people to do. It's super, super hard to get things into studies and get through a process of actually reducing this on a massive level. So when people are doing this more, when we have people that are able to do this, and we do these procedures and we can show data, and I'm part of a lab that actually is collecting data and demonstrating this stuff, so we can show that this is what happens when we do certain procedures or certain ways of treating a patient, thinking about this as a whole. That's how we can actually go and push the envelope and move things a lot faster. So when you think about, there are a lot of anti-aging therapies or clinics, and a lot of that has to do with aesthetics, and that's very nice because the skin is super important, and we're diving into that a bit. But I think this is one of the more comprehensive measuring, testing, and anti-aging type of programs out there. And we've looked a lot at, at a lot of different ones. So overall, thanks everybody for joining us on Zoom. I hope that was all clear, and I hope everybody could see the screen well enough and hear me well enough. Thanks for joining us today. It was very nice, and we'll be holding one of these probably once a month. And if anybody you know is interested in learning about this stuff, please invite them. We'll send you guys some emails about that. Okay.
Sweet.
All right. Thanks. Thank you guys very much.